We're sitting down talking with Dr. Wendy Chang about women freezing their eggs. This can be a great option for women with medical issues or women who want to delay starting a family, which is something that can happen, especially with career and all that. But there is a significant downside for this and an upside. So, Dr. Chang, we're going to talk a little bit about that.
So does this actually help you psychologically, like with stopping the biological clock? Because most women today have opted to, hold off on having a family, they have their careers, and then as they get older, they're worrying about their biological clock. So does this give us some kind of safety net?
Well, yes and no. The whole idea of a biological clock stems from the fact that unlike men who are fertile well into their golden years, we're born with all the eggs we will ever have. And once we hit puberty, we lose 1,000 or more a month. Oh my gosh. On top of that, they're aging right along with us. So that means that as we get older, pregnancy rates dramatically drop. So the woman's monthly chance of getting pregnant is probably about 30% in her 20s, down to 5% at 40, less than 1% by the time she's mid to late 40s. So freezing eggs, whether you freeze 10, 20, 50, that's not going to stop this process. But I like to think that it pauses the clock. It enables a woman to say, okay, I'm going to try to harness and capture the egg quality and numbers I have when I'm younger for use at a later age, potentially even into menopause.
Wow. Is this a sort of an this has been around for a while, but is it a fresh way of thinking about it, or more women seem to be warming up to this? No pun intended, but I see some celebrities that are making this joint. Yeah.
So yes, you're absolutely right, because historically, because this is a medical and surgical procedure, it really was developed for women who are at a high risk for early menopause, what we call premature ovarian failure. So we're talking about women who have cancer, who need to undergo chemotherapy, radiation, or maybe even extensive pelvic surgery that can damage the ovaries or affect their blood flow. But because we know it's increasingly effective, it's extremely safe, we're now expanding this to include women who are doing this electively. That means they don't have the risks, but they want to do this to try to preserve some of their eggs for later use. And in fact, that's the most common indication for egg freezing now in many centers, including our own.
Well, I know, Laura, you have a reason why you want to do that. You're looking into freezing your eggs. You want to tell us why?
Yeah, well, you all know, everyone at home and our home and family knows, I had a breast cancer scare about a year ago. I'm 33, just turning 34, and my mom actually passed away from breast cancer. So I've been tested for the BRCA gene, and fortunately I am negative, but knowing that I'm higher risk and I'm nowhere near ready to have a kid right now, I do want children one day, so I've been thinking, is this something that might be right for me?
Absolutely. So you are a great candidate because of your age. We know that the best chances for getting pregnant after freezing eggs happens if a woman is under 40, ideally under 38, and in your case, being under 35 is optimal. The best egg quality happens when we're in our 20s and 30s, when we're not even thinking of using our eggs. But you also touched on another medical reason. Women who carry the BRCA mutation actually do have a higher risk of ovarian cancer. And oftentimes their doctor would say, we recommend you remove your tubes and ovaries when you're done having babies. But many of them in their 30s and 40s haven't even started their family building. So had you been positive, this is also a good way to think about freezing your fertility for later use.
Tamala, have you thought about this at all?
I've actually recently gone to a fertility place and had a consultation about freezing eggs, and I'm very interested because 40 is creeping up and I want to have babies, so I'm very interested in that.
Good. That's good that you're taking charge and getting tested.
Yeah.
Well, listen, there's so much to explore here. We're going to step away and come back, find out some of the downside, the cost factors that are there, what the risks are involved, and see if any other family members have questions as well. Do not go away. Right back.